Hi there, and welcome back to the Age and Grace podcast. My name is Andrew Blakey, your host. And today we've got an exciting day because we've got somebody who is doing transformative work in the Collingwood wellness space. Hilary Boucher is a highly respected bodywork practitioner known for her unique ability to blend therapeutic touch with nervous system regulation, fascia release, and other areas of wellness. She's helped all sorts of different clients to feel more connected and grounded and at home in their bodies, especially those navigating chronic pain, burnout, or midlife shifts. Her sessions aren't just treatments, they're experiences. And if you've ever felt like traditional approaches haven't quite hit the mark in your life, then this conversation might just change how you think about healing. And if you haven't done so already, click the subscribe or follow button, which helps us to reach more people and help us to grow this show. I'm very excited, so let's get into this. All right. Good day, everybody. Welcome back to the Age and Grace podcast. Today, I'm very excited about today's episode because we're diving into a part of wellness that, in my opinion, often gets overlooked, which is bodywork and the connection between how we move, how we feel, and how we heal. Now, my guest today is Hilary Boucher. She's a gifted bodywork practitioner based in Collingwood, Ontario. She's built a thriving practice that blends therapeutic touch with a deep understanding of the nervous system, wellness, and the mind-body connection. So our work goes far beyond just treating pain. It's about helping people feel at home in their own bodies again. So Hilary, welcome.
Thank you for having me.
So a little bit of a backstory. I first came across your work through kind of like a mutual client. And the more that I learned about the work that you're doing, the more I knew that I wanted to have this conversation with you. I feel like you bring like a very unique, practical approach, even in your social media posts and stuff, which I absolutely love. But before we kind of get into anything, I know that last time we talked, you told me a little bit about your story and how you got into doing this kind of work. So would you mind kind of sharing to the people that might not know you, how you got into it, what it is that you do?
Yeah. So, I started in movement quite young. I was actually pursuing a career as an athlete. I was studying classical ballet, and I began training professionally around 13 years old. And at that time, I was living away from home. So I was training quite intensively, 5-6 hours a day, 6 days a week. And around that time, I began to have some reoccurring health issues that actually stemmed from a developmental anomaly that I was born with. So from that time, from about 15 to 21 years old, I was sort of in and out of hospital and sort of trying to manage this while still pursuing a dance career. And around 21, I underwent a major abdominal surgery, and that ultimately was the catalyst for shifting my career into health and wellness. So I ended up firstly in the gym, and that was sort of an attempt to re-strengthen my body ultimately so I could get back to dancing. And I remember looking around at the personal trainers with their clients, and I remember sort of thinking, I could do this. I think I have a good understanding of how the body moves. I think I could teach people how to move their body. So I decided to get certified as a personal trainer. So that was sort of my entry into the wellness space. And then right out of the gate, I just had most of my clients that I began working with had pretty severe health and body limitations. So most of the things you learn in traditional personal training, squats, bicep curls, all that stuff, none of that was applicable to these people. So I had to learn pretty quickly how to adapt my style and improve their overall function. And so this was around 2009. So in 2007, the first Fascial Research Congress took place. So fascia...
That's not that long ago.
No, it's not that long ago. So fascia, it was kind of a new thing that we were talking about. So I started to read more about it. And the more I learned and applied to my clients, the more I was helping them. And that sort of was kind of up my alley. And, from there, I started on a trajectory to explore fascial specific work. So in 2011, I met Ann and Chris Frederick, who founded Fascial Stretch Therapy. I got certified with them. I began working more exclusively in therapy setting with my clients. And then I was finding that my clients were leaving their appointments feeling lighter, which is a good sign of tissue work. They were feeling more upright. They were having better range of motion, less pain, but they were coming back 6, 8, 10 weeks later complaining about the same pains. So I was finding that, stretching was indeed helpful, but it wasn't changing their structure. I hate using the word posture just because it's not accurate in this context, but their structural positioning, what was causing them pain. So I realized I needed to get more hands-on. And so in 2013, I met Tom Myers and decided to take a short workshop with him on manual fascial release work. And Tom was world renowned in fascial release. So in fascial research, really. And so I figured, if I'm going to learn about fascia, I should probably learn from this guy. And, what I experienced in those 3 days was really profound on my own body and sort of shifted how I looked at the body. So I sort of joke with people that I'm not really a type A, I'm sort of a triple A. So I decided that this was what I was going to learn. And so I studied at the Anatomy Trains Institute, which is Tom's Institute of Learning from 2014 to 2015. I got board certified in the States, moved back to Toronto, opened up my practice, and that's what I've been doing ever since. And, since then, as we're always learning about the body. There's so much to learn. So I've also found passion in, the cranial sacral system and the visceral system. So I've sort of continued my education in cranial sacral therapy and visceral manipulation. And yeah, that's kind of where I'm at.
That's amazing. It's amazing because I know that even in the work and the stuff that I've heard about you through, my own clients who have worked with you, they all say that they feel lighter, they feel better. And they're like, I don't know what she did, but it helped. So, I know how great a work that you do. And so you mentioned structural integration. I know that you're board certified structural integrator. And really, before I met you, I didn't really know much about what that meant or what that was. So I'm sure there's people at home who also, this might be the first time hearing that term. So what exactly is a structural integrator?
Yeah, it's a great question. Structural integration is its own modality of bodywork. So just like chiropractic or osteopathy or massage therapy, it is sort of unique in that not a lot of people, particularly here in Canada, are aware of it. But as a form of treatment, it predominantly works with the fascial system of the body. And because our fascia is quite literally everywhere, it impacts the various relationships with our joints and our nervous system and many other systems of the body. So structural integration can help people sort of in a variety of ways, but really it aims to realign the body. And generally speaking, it's quite effective for different types of chronic pain.
Right. And so what are some common conditions or things that you see, day to day when you're working with clients? It's a hard one, sorry, being on the spot here.
Yeah, I see a lot of different things. Everything from common conditions like things like plantar fasciitis or accumulative back pain. And, folks that find me are often pretty desperate. So they've often exhausted their other resources. They don't know what it is that I do. They often see me online and they feel like it resonates with them or it's something that they need. So I've received clients, that have all kinds of disorders and rare conditions and things that people just can't explain or specialists have been unable to explain. And they sort of land in my office and hope I can help them.
Fair enough. And so with structural integration, you mentioned that a big part of it is with fascia. And I feel like the fascia conversation is something that, before 2015, we didn't really talk about that very much. And so what exactly is fascia and why is it, an emerging topic in health, fitness, I guess overall wellness?
Yeah. It's defined as any collagenous-based soft tissue of the body. So that's really anything, it's all of the tissue, including our muscles, our organs, anything but pretty much blood, lymph, nerve, bone. So if you didn't have your fascia, you'd basically be a puddle of fluid and bone on the floor. So, typically in the past, we didn't see it as important. In surgery, we sort of cut it away and throw it in the garbage. It's kind of in the way, right? And in anatomy books, we looked at sort of the pockets of tissue, so the muscles. But the more we're learning, we sort of mentioned earlier that, our research on fascia is very recent. So the more that we're discovering and researching on fascia, and, we're so grateful to have so many pioneers in this area now that it's such an important part of our immune system. It's a fluid system. It transports waste and nutrients through our body. And, I like the way Tom describes it. He sort of describes it as the biological fabric of our body.
Interesting way to describe it.
Yeah.
It's so true from what I'm hearing though, right?
Mhm.
Yeah. Okay. And so a while back, I did an episode with a doctor and we talked about how old pains, old injuries affect us, later in life. And so when it comes to fascia, how can, old injuries or tension or trauma, how can it does it get stored in the fascia? Like, where does that all kind of come together?
Yeah, I mean, our fascia is because it's a hydration system. I mean, we're born and we have so much fluid in our body, right? So our tissue and our body is quite buoyant.
Mhm.
And, we're subject to gravity from the minute we come out of the womb. And so, our whole evolutionary process is to become more upright in space. And yet we have this gravitational force on us. And over time, that compression and the process of aging is essentially the process of drying out when it comes to our tissue. We sort of go from a grape to a raisin. We sort of shrivel up. And because of that, we lose that elasticity. We lose that slide and glide of our tissue. We lose that buoyancy in our body. And so, that can lead to layers of tissue getting adhered, and that impacts our movement. And it's like, I see my son, he's 2.5, and, he runs, and if he falls, he practically bounces and gets back up and keeps going, where, if my grandmother fell, she would probably break her hip, right? So as we age, the quality and vitality of our tissue impacts our overall health for sure.
Mm-hmm. And so all these different conditions and stuff, I mean, ultimately, the older we get, the more stuff comes up, right? But when it comes to kind of when you're working with somebody specifically, say, for example, you've got tissues that are adhered to it together or something like that. What do you do in a session? And I guess, again, it's a big question. I mean, I'm sure it depends on what it is, but what kind of paint a picture for us a little bit?
Yeah, well, I sort of blend my various backgrounds. So a lot of it is assessment. One of the things that makes perhaps this style of body work a little bit more unique is that we do body reading. So we look at the body standing, we look at the breath of the body, we look at gait patterns and movement. And, then there's other tools of assessment. So we have, visual and, what our hands are telling us with the tissue. But typically when I'm working on someone's body, when you're working with fascia, you're sort of sinking into what I would call the first available layer. And that's different for everybody. And from there, tissue is sort of has a quality to it where if you're listening to it and you're working with it, there's somewhat like an art to it. It can kind of start to almost melt under your hands.
Oh, really? Okay.
And it's different from pushing your way in. There's a difference between invasion and invitation in the body, and the nervous system responds to that. And typically I find when I first start working with a client, their nervous system, even if they're super receptive and they've had lots of body work in the past, their nervous system is a little bit more guarded, they're learning who I am. And so, the amount of work you can get done in the first session might be completely different than the amount of work you can get done in consecutive sessions after, because you're getting to know their body. And again, I really like how Tom describes that kind of interaction, because he says, body work is a conversation between two intelligent systems. And I think that's such a great way of describing it.
Right. And I can tell even just in the way that you talk about how passionate you are about this field. And again, I've seen how it's helped other people that you've worked with, which is incredible. I mean, I feel like it's an area that, people need to kind of explore a little bit more. But one of the things that you just mentioned, so you talked about how it's almost like you kind of get into the first layer and the second layer. And so does it, by that, do you just kind of mean for people at home, your muscles are ultimately layered. They're not just, single layer of all your muscles. You got some closer to the surface, which we call superficial, some that are deeper. And so when you talk about layers, do you just mean kind of working from, the most superficial muscle? Once that can kind of get through it, kind of move on to the next, not necessarily muscle, but whatever the structure is. Is that kind of what you mean by layers?
Yeah, kind of. It's different depending on what I'm doing with the body. So in visceral work, it's very much like that. So visceral work, for people that don't know what that is, it's fascial mobilization of the organs, so our viscera. And when you're working in the abdominal cavity, there's a ton of different layers and sensations you're going to feel under your hand. You're going to feel anything from fluid to tissue to scar tissue, if that's applicable. And so when you're sinking, you're sinking anywhere like 9 layers deep. And so when you start to develop your touch, you start to feel what layer of the body you're in and what layer you need to be in to access a specific organ, depending on its location in the body. When you're working with, the limbs, for example, and other layers of tissue in the body, I don't think too much. When I'm actively working on the body, I'm a lot less in my left brain and I'm a lot more in my right brain. So I think less about what muscle am I on, what piece of the tissue am I on, and I think more about what am I feeling right now? How can I follow that?
Wow. I find it like so fascinating because like ultimately, as a trainer, like I'm not pressing on people and stuff like that. And so you talk about kind of getting a feel for it. I feel like that is like a skill in of itself, right? Because you're really, you're touching things in a way that, we don't do that every day, right? I'm sure there's a whole practice of getting good at that and learning what that feels like, right?
Yeah. When I first started practicing bodywork, when I went to Maine to do my structural integration program, typically it's considered advanced manual therapy. So typically you need to have about a 5-year background in palpation. And I didn't have any background in palpation. I felt a bit like a fish out of water. And, in SI work, we're working with anything from our fingertips to our fists to our elbows. And because of my stature, I'm 5'2", and sometimes I'm working on these big people. I often use my elbow and my forearm. I find that to be a very effective tool for me. And in the beginning, I had no idea what I was feeling under my elbow. But after practice, your neural pathways of your brain adapt. And now under my elbow, I can feel what scar tissue feels like versus, tissue that's moving and things like that. But, 10 years in, right? So,
yeah. Yeah. Wow. Maybe I'm weird or odd or whatever, but I just find that so cool and so interesting just in and of itself, right? It's a whole different world, but yeah, just wild. And so kind of bring it back to fascia. So what kind of role does fascia, I know that's, encompasses a lot of different things, but what kind of role does fascia play in things such as chronic pain? Actually, let's start there. There's a couple of things I want to touch on, but let's start with what kind of role does fascia play with, aches and chronic pain that somebody might be experiencing?
Yeah, I would say, it might be a strong opinion, but I would say, pretty much with any element of chronic pain, there's an element of our fascia involved in that because, your fascia permeates through bone. And traditionally, the way we studied the body was that, the skeletal system is the bony base and the muscles move us like a puppeteer and everything centers around the bones and the joints and the alignment of that. And even though that is important, our tissue is strong enough to offset all of that. So, if our tissue is not in alignment or a tissue has dysfunction, then it can throw off our entire system. And it is one big system and it has other systems within it. So it's such an integral part, I think, of overcoming chronic pain or structural dysfunction in the body. I think it has to play a role.
And I feel like that kind of answers my next couple of questions too. I was going to talk about what kind of role fascia plays in like mobility and movement, but it kind of just sounds like everything's connected, right?
Yeah.
So if somebody's at home and they want some, simple practices to help promote, healthy tissues or healthy fascia, either, on their own or in between like sessions with you, what can they do? What are like some simple things somebody could do at home?
Well, when I begin working with a client, one of the things I like to know is how hydrated they are. Because hydration is, we all know we need to drink water and eat our vegetables and all that stuff. But, hydration, because our tissue is a fluid system, we have to be taking in fluid in order to make change in that system. So I liken it to taking a dried, crusty old sponge and putting it under the tap. That water is going to bounce off of it for a really long time. But if you break up the sponge under the water, it's going to absorb it much faster. But that's provided the water's there in the first place, right? Mm-hmm. So, when I'm working with someone, I explain to them that when we're creating space in the body, which is ultimately what you're doing when you're decompressing the fascial system, you're not filling that space with air because we don't have air in the body. You're filling it with fluid or blood, provided you have that fluid. So hydration, drinking water is a really important aspect of improving your tissue health and vitality along with getting it worked on. So that's something that I strongly encourage my clients to do, generally speaking, but certainly in between their appointments. And then movement, that whole saying motion is lotion, right? Movement is a really important piece of integration of your structure, especially when it's changing. So movement, particularly a variety of movement, is really healthy for your fascia, and hydration.
Yeah. Interesting. Yeah. I feel like, now that you mentioned hydration, now I'm like, oh, now I keep grabbing my water. I'm just like, I have not been drinking enough water today. But I feel like hydration is one, it's kind of funny because like everybody like knows it's important, but I feel like we don't actually, like, we're not like consistent. I mean, I can't speak for everybody. I can only speak for myself, but I mean, I know that I'm not consistent with it throughout the day. It's something I'm working on, but I feel like it's something that's like, we all know the importance of it, but like, it's almost like we don't want to hear it or listen to it,
Yeah. And I mean, easier said than done too, right? Like, I mean, I have a bathroom right down the hall, so it's easy for me to drink lots of water, right? But somebody that might spend their day in a car or, on a plane, it's a little bit harder. And so, of course, we have to adapt based on, the demands on us too.
Yeah, fair. And so do you have any like aha moments that you can think of, like when somebody like comes to work with you and like you start explaining like what you're doing and stuff and they're like, that makes sense, or like just like any aha moments?
Yeah, I think all the time. I think, when you kind of start to explain things to people about their body, I like to teach my clients about their body. I don't just want them to come in and receive work kind of passively and then, they leave. I want them to know what it is they're doing, why they're doing what they're doing. I think that's a really important part of them being involved in their own healing process. So yeah, I think, when I kind of start to teach people about their body and explain more about fascia, you can kind of see like, yeah, that makes total sense. Or I see that and I didn't see that before. But certainly it's really fun. I might work on somebody and they're used to having somebody, stick their elbow in their back, and I come in and I'm working on them in such a way that they might not feel like something's even happening. And then, they get off the table and they kind of stand for a moment. I always like to reassess my clients after they have treatment and we sort of reassess them and you can kind of see it in their face. Like, wow, like, I feel so different in all these different places, even though you only might have worked one spot,
Sounds rewarding. It sounds very rewarding. It's stuff that like you can like directly see that because of whatever modality or whatever treatment that you did, it's like, oh, based on that, this is what happened. Especially because you've been doing it for like as long as you have. I feel like you're just that much more sensitive to like being able to see exactly how the change occurred, right?
Yeah. I mean, I'm still, always learning, but yeah.
Yeah, amazing. So we've talked a lot about fashion. I'm sure that we're going to get back to that soon. But I want to talk a little bit about kind of like foot health, grounding, like functional movement. And so not long ago, I released an episode all about foot health. So I kind of want to get kind of your opinion on some certain things. And so when it comes to like the work that you do, what are the kind of the more common issues that you see related to like foot health in particular?
I would say pretty much everybody I see has. Most of us do not have competent feet and arches. And so, I see anything from, quite common conditions like plantar fasciitis to back pain, which a lot of people don't relate to their foot support and arch support.
How does foot support relate to back pain?
Well, we're all born with flat feet. And we don't really have curvatures of our spine. I mean, we have a curvature in our neck, but quite minimal. And when we start with babies, we start putting them on their tummy and we do tummy time with them. So they have to start lifting their head and that's starting to strengthen their back. And then they get enough strength that they start to become sitting up. And you can actually see around that age, around like 4 months when a baby starts sitting up, if you look at their back's like completely flat.
Oh, really? Okay.
Yeah, it's quite interesting. And then, once they get enough core support, then they become more vertical and then they're up on their feet. And, you can kind of see, we've all seen those toddlers walking around and they're almost like, they look like they're drunk a bit, right? But they're out of balance, right? And really what they're doing is they're building their arches. So all that tissue in our lower legs, in our calves, in our shins, and all through the front and sides and all the aspects of our lower legs, all that tissue comes down into the base of our arch and it attaches into different areas. And when we're learning to strengthen our legs, we're sort of hoisting up and building our arch. And so there is a direct fascial connection, with the myofascial meridians, they call it the superficial back line, but there's a direct fascial connection that runs from the base of the feet up through the spine and connects all the way to the top of the head around the frontal bone.
Oh, wow.
So there's not only a direct fascial connection, but in development, anatomically speaking, we are building those areas together at the same time.
Yeah.
So, typically if somebody has chronic back pain, you have to address the support from their feet and vice versa.
Yeah, a lot that goes into it. I mean, same thing. I feel like we keep coming back to like everything is connected, right? Yeah. And I'm glad you brought up the plantar fasciitis part actually, because so I got a question on Instagram and it was kind of a question. It was more just the word was plantar fasciitis. And that was it. So we're going to talk a little bit about plantar fasciitis. And what can you kind of tell us? Like, is there different causes, different things that can, contribute to somebody, getting diagnosed with plantar fasciitis? Or is it kind of like more of like, okay, this is what it is? Like, tell us a little bit about what it is, first of all.
Yeah, well, plantar fasciitis is really describing inflammation of the plantar fascia of the foot. So that specific fascia. The way, depending on who you talk to, people have different opinions on this, and there's quite a few strong opinions out there. But, the way I sort of explain it to my clients is, anything with an itis, tendonitis, plantar fasciitis, anything with an itis is really sort of describing chronic inflammation. And typically, by the time someone's been diagnosed with plantar fasciitis, they already know they have chronic inflammation because they're aware of it. So, I think in my opinion, globally speaking in the body, I think there's a lot of things that play into factors of why somebody might have chronic plantar fasciitis. Some people have it on one foot. Some people have it interchangeably. It goes back and forth between 2 feet. Some people have it on both feet. And when I look at a body or when I work on people, I often find correlations between how everything up top is sitting on their feet in relation to their feet and how it affects them. So, it's really important if you're going to solve a problem in the foot that you have a really good understanding of how everything else is sitting on top of the feet, because that's a really big job for your feet.
Right.
So if somebody has a rotation in their pelvis or in their spine and they're a runner,
right.
Running is like walking on steroids. They're going to be constantly torquing on one side, and then they might have plantar fasciitis on that one foot because that foot has to work really, really hard.
Right.
If somebody has compression in their spine and they're sitting forward in their body, the feet are trying to hold them so that they don't fall forward onto the ground. So that's a lot of work to do on the feet. So I think in a nutshell, I think there's a lot of different things that play into why somebody has plantar fasciitis. And because it's so common, to me, that makes sense that it probably is a cumulative of lots of different dysfunction in the body. Right. But typically, if you can reestablish the arch or integrate the arch in such a way that it's supporting the body and then integrate the rest of the body on top of the feet appropriately, typically that goes away.
So how do you do like the reintegration of like the foot stuff?
What do you mean, Andrew?
So so you just mentioned like how it's important to like rebuild the arch or to kind of focus on the arch. So like if somebody is dealing with plantar fasciitis, what are like some things that they can do at home? And I guess same thing, like you said, it depends on kind of everything above it too. But do you have any like tips for like relief or anything like that somebody can kind of take away from today? Yeah,
I would say that really, getting some tissue work on the arch itself, I think is an important thing. So looking at I really like to recommend certain bodywork tools. There's a hand and foot treatment called Melt Method that I really like that has these really little tiny balls. A lot of people use like a big lacrosse ball and they sort of roll it on their foot. And, because the fat pad of the foot is so thick, you're not really going to make much change with that. But if you can get a tiny ball, such as the Melt Method ones that are a little bit bigger than a marble, that's going to fit into all the different bones of the arch and start to kind of mobilize them and reestablish that movement and flexibility in the foot. So I often, if clients have a lot of dysfunction in their arches, I'll recommend them to do that. Certainly, if you take away the foot's ability to do the flexible movement it's required to do, then that's going to cause problems too. So I recommend barefoot wear. I recommend people are barefoot as much as possible. It starts in childhood, right? Like we put our toddlers in these big sneakers and they can't feel the ground. They should really be barefoot as much as possible to start developing that competency at a young age. And, I will say too that some people will say to me, well, I've tried barefoot footwear and it hurts my feet. And, that's not uncommon, an A for effort. But what I say to that is, if you don't have strong arches or you don't have arches that are doing what they're supposed to be doing in the first place, and then you put on barefoot shoes, yeah, you might aggravate them. That's like going to the gym for the first time when you've never worked out before and you're trying to deadlift 250 pounds. Your body's like, I don't know how to do this and I'm going to hurt myself.
Right.
So part of it, it's kind of a twofold thing. Part of it is reestablishing the arch and the foot support, and then working it out by taking away all these, artificial insoles and things that are designed to sort of support our foot and get the foot to do it on its own.
That's interesting. That's a interesting perspective. Yeah, I feel like a lot of people kind of like rely on, I don't want to say band-aids because that's not the right word for it, but kind of like temporary fixes to help give them relief, which is great. I mean, if it gives them relief, then great, but we're not really kind of addressing the root problem of it, right?
Yeah.
And so when it comes to footwear, we mentioned kind of a little bit of footwear stuff just now. So when it comes to footwear, how does like the shoes, like, if somebody wears dress shoes all the time, or if somebody has to wear heels all the time, kind of how does that play a role on our foot health?
Well, if you restrict the foot, then, you're not allowing it to do what it needs to do. So, our body is a really intelligent system and it's going to adapt to what we are constantly doing to it. So if we are constantly wearing high heels, for example, then the rest of our body, including our feet, are going to adapt to that. So, we live in a culture where part of that is in some ways necessary for, our work or what have you. But, I would say if you have well-integrated foot and, you have a healthy body, generally speaking, you should be able to, maybe walk around for a night in footwear that's not really ideal and survive.
Right. Treat yourself, right?
Sure. But, all the other hours of the day, what are you doing with your feet and how are you caring for your body?
And so if somebody has like a job where they have to wear, heels or something or dress shoes, whatever it might be, do you have any like tips or advice for them? Like to, I don't know, if you're at your desk, take your shoes off or like anything that you kind of advise them a little bit on that?
I'm not the best person for that because aside from my dance background, I walk like a baby giraffe in heels because I wear them more. But I would say, as little as possible. There, back in, when I got into this industry, there was like 2 companies that had barefoot shoes. And, they were in Europe and very expensive and hard to access. And, now there are so many companies that offer all different kinds of footwear for so many different needs. So, I would say when in Rome, when you have to, you have to. But again, like all the other hours of the day, wear footwear that's going to support your feet and try not to if you don't have to. And I mean, some people like to, right? It's a stylish thing and to each their own.
Yeah. Fair. I feel like that's a good way of putting it. What are some things that you would want somebody to kind of take away from this conversation? I mean, we covered a lot, which is amazing. I can tell, how much knowledge you have in this space. Do you have any like quick takeaways for somebody after this conversation?
Yeah, I would say, get curious about your body. If you're having body pain, ask yourself some questions like, I think our body is an intelligent system and usually it's trying to talk to us. So I would say get curious rather than treating it like a nuisance and be open-minded.
Mm-hmm.
Yeah.
Love that. Love that. And if somebody wanted to kind of reach out to you or kind of get in contact with you, how would they do that?
I'm on most social media platforms. A lot of people find me on Instagram, TikTok, Facebook, my website, Hilary Boucher Bodywork. Yeah.
Awesome. Well, thank you very much for joining us. Like I said, I've been very excited for this conversation to have you on. And I appreciate you being here. I can tell, again, how passionate you are about it and how deep you've kind of gone down this rabbit hole for this space. And so, yeah, I really enjoyed chatting with you and hopefully you'll be back again one day.
Yeah, I'd love that. Thanks for having me.
Thanks, Hilary. That's all we got today for you guys on The Aging Grace. Until next week, I'm Andrew, and have a great week. Well, folks, that's all I've got for you today on The Aging Grace. Today, that was with Hilary Boucher, a structural integrator and body worker. And make sure that you click that follow button because next week we've got another phenomenal guest. I'm very excited for this one. We have got Gina Livy coming to join us on the show. She has worked with over 100,000 people to help them lose weight and keep it off. So make sure that you click that follow button so you don't miss that episode because I know it's going to be a doozy. Till next week, this is The Aging Grace.